Hi, my name is Candace Langsfeld, and today I am giving a presentation on tuberculosis. The causative agent of tuberculosis is Mycobacterium tuberculosis. It was discovered in 1882 by Robert Koch. It is a highly contagious aerobic pathogen, which means that it requires oxygen to grow and is non-motile. It is an intracellular pathogen, which means that it infects the macrophages of the body's immune system. And the reason why this bacteria is so effective is because of the waxy coat of mycolic acid that envelops the bacteria. This makes staining very difficult and is a key virulence factor for the bacteria. So transmission and symptoms of tuberculosis. Transmission is through infected droplets in the air. When someone that is sick with tuberculosis coughs, sneezes, spits, talks, infected droplets can get from the lungs into the air that other people are breathing. And when someone that does not have the disease breathes in these infected droplets, they can become sick. So some of the main symptoms of tuberculosis come from the pulmonary system, since that is what tuberculosis mainly affects. And these are some of the few that can happen. You can have pain in the chest, coughing up blood and sputum. You are very weak, fatigued, usually have no appetite, and weight loss can occur from that, as well as chills, fever, and sweating. So how does tuberculosis infect the body? So when tuberculosis is expelled into the air, it can get into your nose and mouth. And once it gets into the nose and mouth, it goes down the trachea and splits off into the two tubes of the bronchi, and eventually gets into the lobes of the lung and the alveoli. This is where tuberculosis causes the most trouble, is in the alveoli. There, the macrophages recognize this foreign bacteria and go to invade and attack it. But once the macrophages pick up the bacteria, because of the mycolic acid, they can't penetrate and kill the bacteria. So the bacteria will eventually start replicating itself in the macrophages, killing those cells, and then start to attack healthy cells. So on the left, this shows the tiny infection starting to occur, and as the macrophages die, it takes out more of the healthy lung tissue, and you get these cavities in the lungs that start to form. On the right, you can see the plaques that are created by tuberculosis. So how can we diagnose tuberculosis? As many of you guys may or may not know or have had this test before, is a tuberculin test. And what the physicians do is they inject a small amount of tuberculosis antigen underneath your skin and have you come back in a day or two and see if there's a raised bump. If there is a raised bump, to confirm that you have tuberculosis, they will require you to do an x-ray of the chest just to be sure that tuberculosis is indeed present. So treatment of tuberculosis. The first effective treatment for tuberculosis was developed in 1940, which is streptomycin. Currently, how we treat tuberculosis is with a combination of 3 to 4 different drugs that all have unique purposes. The first purpose is for antibacterial activity, and those drugs are isoniazid, rifampin, and streptomycin. And then another purpose is to inhibit the development of resistance to these drugs, which isoniazid is also administered, as well as rifampin, ethambutol, and pyrazinamide. So here's a picture on the previous slide, just to give a little more detail. So isoniazid and ethambutol inhibit cell wall synthesis. Rifampin inhibits RNA synthesis, and pyrazinamide has several purposes, one of which is to disrupt metabolism of the bacteria. So, history of tuberculosis. It was thought to be a genetic disease. This is when farmer families were living in very close contact, and pretty much every single family member came down with the disease, so they always thought it was genetic and hereditary until proven that it was this bacteria. It was the greatest killer worldwide due to a single infectious agent, and many feared that it would bring an end to society. Back then, the treatment for tuberculosis consisted of putting someone on a stretcher out in fresh air and letting them rest. And in extreme cases, physicians would induce a collapsed lung to heal tuberculosis. In the 1940s, when streptomycin and isoniazid were introduced, many thought that tuberculosis would become eradicated. So, tuberculosis in our world right now. A third of the world's population is thought to be infected with tuberculosis. And we have about 1.4 million TB-related deaths that were recorded in 2011. 90% of these tuberculosis patients have latent infections, which means they are asymptomatic and healthy. 10% of these will develop active tuberculosis in their lifetime. And the last thing that I want to talk about is MDR-TB, which stands for multi-drug resistant tuberculosis, which is still a problem. On the right, I just want to point out really quickly, is the distribution of cases of tuberculosis. In the darker areas is where it is more serious. In the lighter areas, we have less cases. So it is still quite a big problem in Africa, as well as some of Asia, down here, and even in South America a little bit. So multi-drug resistant tuberculosis. MDR-TB is tuberculosis that is resistant to at least isoniazid and rifampin, which are the two most powerful first-line anti-TB drugs. This can be due to many things. It can be due to mismanagement or misuse of the drugs. So patients don't finish their full course of treatment, or patients aren't able to receive effective therapy, maybe in a third world country where they don't have access to the drugs that we do, or the healthcare physicians don't prescribe the right amount or for the right amount of time. So how can we solve this problem? First of all, quick diagnosis by healthcare providers. And when those healthcare providers diagnose these patients, they have to monitor the response to the treatment, if it's working or not, and follow the recommended treatment guidelines for the appropriate amount of drugs to be administered and time. And they need to make sure that the therapy is completed. That's all I have today. I hope you learned something new, and have a great day, and thank you.